Hello, and thank you for joining us for our discussion today about ways we can ensure a safe return to school for our kids this year. My name is Cynthia Ramnares. I am a managing editor with the digital communications team at NYU Langone, and I am very happy to be joined today by two of our pediatric experts. We have Dr. Jen Leiter. She is the hospital epidemiologist at Hassenfeld Children's Hospital at NYU Langone. And we are also joined by Dr. Sara Siddiqui, who is one of our pediatricians at Huntington Medical Group. Thank you so much, both of you, for joining us.
And now, with vaccines available for everyone 12 years and older, it's important to prioritize schools and deem them essential and provide the schools the resources they need to keep the spaces safe. As far as getting kids ready and talking to kids, I think it's important to emphasize to kids that schools are safe spaces, and it is important that kids do their own part in keeping themselves and their friends and classmates safe as well, and wearing their face masks. And abiding by the rules and procedures for that school.
Mm-hmm. Well, let's talk about face masks. Somehow those face masks have been quite a conversation. Dr. Siddiqui, what information or what recommendations do you give to your parents and children, patients, regarding mask usage? What's the proper way to wear a mask, and why do masks work?
So we want to make sure that, as Dr. Leiter said, that we get everyone back in school as safely as possible. And one of the ways to ensure that is to make sure that we wear our masks properly, among all the other mitigation techniques that we've been reviewing. So hand washing, distancing, staying home when you're sick, contacting your pediatrician to get tested if necessary. Wearing a mask is one of the important parts of all that. And you want to make sure that you go over with your child. You want to get a proper fitting mask, make sure that it's covering the mouth and the nose, make sure that it's properly fitted behind the ear, that it's comfortable for them. Mm-hmm. You want to make sure that they wash their hands prior to placing the mask and even prior to removing the mask. And you want to model the behavior at home. So you want to make sure that if you are going out and about or indoors in a crowded area, that the adults in the family are also wearing a mask when they go out, so that the children are comfortable wearing masks when indoors as well. And of course, we're going to have, most schools will have mask breaks incorporated into the day as well, to make sure that nobody gets uncomfortable during the day.
Great. Dr. Leiter, what about the types of masks? Are certain masks better at protecting your child? Cloth, the N95s, the paper. What's your take on the types of masks?
N95s are not necessary. N95s are really for the healthcare workers that come in very close contact to people that are contagious with COVID. So they're actually caring for patients. N95s are not necessary for, most of the public. As far as cloth masks, several studies have shown that they're not as effective as just a simple surgical mask. So, my kids wear a, kid-sized surgical mask when they go into school. So, there have been several studies now that have shown the efficacy of masks. Masks are definitely effective, at reducing the transmissions. There have been many small studies, but just this week, a very large study came out that was conducted in Bangladesh in 350,000 people, 600 villages. And they looked at villages that, they provided masks and did a lot of education to adherence to masks versus villages that did not wear masks. And the villages that wore masks, the adherence rate was about 42%. And just with the 42%, there was 35% less infections in people over age 60 compared to the village that did not wear masks. And that was the only real difference between the villages. So, and this was repeated on, 600 villages. So it was a very large study that really showed the effectiveness of masks that just came out last week. that I think is just, really important, because masks are just a simple lift. They are virtually free and they prevent transmissions. And it really shouldn't be politicized. It's really not a big deal for people to wear face masks, because it keeps oneself and others safe, and it protects your community.
Absolutely. But face masks are part of the equation, right? I know we've talked about, at the beginning of COVID, I feel like everyone was talking about 6 feet of distance and washing your hands all the time and things like that. How important are those still, Dr. Siddiqui, to keeping kids safe, especially in a close environment as a school? How do we maintain those aspects of keeping kids safe?
Absolutely. I mean, in a school environment where this year we really want full in-person school, so it is going to be a little bit more crowded than it may have been last year at certain times, because we really do want everybody in person and not remote at all, because we do know that didn't work for a lot of our children. And having said that, we want to make sure that there is at least enough spacing available to accommodate that. But there is also ways to improve circulation as well. You can, the ventilation and circulation of the air inside the school will help in mitigating some of the spread that may occur. Again, wearing the masks, staying home when you're sick. So that's really very important, making sure that you find out through testing or through visiting your pediatrician that you're not coming into school with a possible positive case of COVID. And I think those measures will really help reduce some of the safety issues in the school building, because we are concerned about how many students we're going to have. But the distancing and hand washing and staying home when sick is also part of all the protecting mechanisms.
Yeah, definitely. Dr. Leiter, we keep hearing about how the Delta variant is so much more contagious than previous forms of the virus. Is this the case with children as well? So, should we be more concerned in schools because of Delta, the rise of Delta over the summer? How are we seeing Delta acting out in children?
Okay, so Delta is definitely more contagious. It does not appear to be more dangerous or virulent. So as far as Delta, in other countries, and now we're starting to see in the United States, there is a Delta rise over 2 months, and then it comes down. And in New York City, we're starting to see that cases are coming down. And also in the United States, we are starting to see that cases are coming down. So that's the good news. But yes, Delta is more contagious, and that it just means that we have to do other measures to try to keep people safe from transmission. So vaccinate all the people that are eligible. Vaccines are safe and they're effective. There really is no question about that at this point. Only 41% of children that are eligible for vaccination have gotten vaccination in the United States. That number really needs to increase to keep children safe. In addition, as we said, the other measures in place keep schools safe. The face masks, the improvements in ventilation, the symptom checks. If the school doesn't have symptom checks, just to go over with the parents and students to notify and not come in that day if someone is feeling sick until they can get tested and it's negative. So when you put all these layers in place, schools are actually very safe spaces. They were safe spaces even before we had vaccination. The school transmission rates are very, very low within the building if all these mitigation strategies are in place. When you have states that are against mask mandates, unfortunately these safety measures in place increase the risk of transmissions. So that is the scenario in states that do not support mask mandates. But when you do have masks and the other safety measures in place, schools are safe spaces.
That's very reassuring to hear, especially if someone is sending my 2 kids to school next week, and on the subways, because this is New York. So good thing to hear about. I just want to thank everyone who is watching, joining us right now. If you have any questions, please post them below. We're happy to pose them to our experts here and bring you into the conversation. So let's talk about vaccines. Let's talk about them. Age 12 and up are now eligible to be vaccinated. I wanted to ask, one of the things I've heard about some hesitation has been that, well, now the Pfizer vaccine has full FDA approval for 16 and up. What does that mean for 12 to 15? Is it not as effective? Is it not as safe for 12 to 15? Dr. Leiter, I'll give you that one.
Yes, so it just means that, it's still EUA approved. It doesn't mean that it's less safe or effective. It just hasn't, gone through the time period and the qualifications it needs to make the full approval. We suspect it will happen, fairly soon, over the next month or two. But it's just a matter of time, really. It will get full approval for the 12 to 15-year-olds fairly soon. It is extremely safe, and we know that it's extremely effective in preventing severe disease.
Excellent, excellent. Dr. Siddiqui, I'm sure you have I'm guessing you've personally vaccinated children against COVID. What is that experience like for a kid? What type of side effects do you see? Is it, what have their reactions overall been?
So I want to start by saying that, yes, the vaccine is safe and effective for 12 and up. And for 12 to 15, it's still emergency use authorized, but we've given out millions of doses. And so the safety profile of the vaccine is very high. And the risk benefits of receiving the vaccine versus getting actual COVID, or someone in the family getting actual COVID, is much, much worse than vaccine side effects. Having said that, we do see some side effects with the vaccine. So it is it hurts a little bit. Any child, when you bring them in and you say, okay, it's time for your shots, is it okay? Can we give you the shot now? And they don't really rush to say yes. But, you can give Tylenol or Motrin for some of the aches and pains, fever that may come with it. Usually the second dose can be a little bit worse than the first one as far as body aches and pains and fever. And really that's a part of your immune system that's bringing up a response. So even when we vaccinate our young babies for the routine vaccine schedule, I always say at the 2-month visit that, don't be scared that your baby's going to have a fever after they get vaccinated. That's really their immune system saying, okay, we're building up antibodies and it's responding. So the fact that there is a little bit of a fever and body aches and pains indicates that there's some response. It doesn't mean that there's no response if you don't have a reaction, though. But I try to tell you that. And then one of the other things that really comes up, and I do try to encourage parents to talk with your pediatrician or give your doctor a call if you do have specific concerns regarding the safety of the vaccine, because we can really address some of your hesitation that you may be having. We do get a lot of questions about that.
What's your number one question you get?
The number one question I have to say is regarding fertility. Unfortunately, a lot of misinformation regarding COVID vaccination, especially in children. People are worried that it's going to affect fertility. And there's multiple groups, the American College of OBGYNs and the fertility specialists have all given their statements, and it's very difficult to have a full statement from multiple medical professionals like this, but they've all given statements about the safety and efficacy of the vaccine, that it doesn't interact with your own DNA, it doesn't cause issues with fertility, and it doesn't cause long-term issues as well. I can't state that enough, that there's so much information about the safety of the vaccination, and I think that's one of the top questions that I get.
One of the things I've seen a lot is concern about myocarditis or heart inflammation, because that has been something that has come up and has been observed. And is that, let me ask 2 parts here. are there symptoms to look for after receiving the vaccine that parents should be alarmed about, or not alarmed, but should bring to their pediatrician? That could be a sign that something more than what is normal or expected is happening. Dr. Siddiqui, I'll give you that.
Yes, absolutely. So with the myocarditis and also pericarditis, which is basically an inflammation of the heart muscle or a little bit of fluid around the heart muscle, that can happen with the vaccine ages 12 and up. And it seems to be more in males than females. And it has been found to be a side effect from the vaccine. Having said that, it is much milder. It is very rare, first of all. Second of all, it is much milder than myocarditis and pericarditis and some of the inflammation that you may get from actual COVID. One of the symptoms that we do request parents to reach out to us about or ask or get in touch with us is chest pain. So if you're having any symptoms of chest pain or rapid heart rate, it's really important to get in touch with us so that we can talk to you about it. And usually this would occur within the first 24 to 48 hours of vaccination. And having said that, though, sometimes when I say chest pain and high pulse or heart rate increases, some of the kids, start getting chest pain right at that moment. But I think that it's really important to discuss with your pediatrician if you're having any of those symptoms.
Okay. Well, Dr. Leiter, how common is this, those type of severe side effects from the COVID vaccine?
Oh, it's very, very rare. It's, I think, like 1 in 50,000 or something extremely rare. However, the rate of myocarditis in teenagers with COVID is multiple times higher than the rate of myocarditis after vaccination. So basically, every MIS-C case that we hospitalized in a child that had COVID involved a myocarditis. So it is like it's multiple times higher the chance that you would have myocarditis from COVID than a child would get myocarditis from the vaccine multiple times.
Oh, so that's interesting.
If parents really want to protect their child from myocarditis, they should get their child vaccinated.
Absolutely, absolutely. I have seen stories about hospitalization rates for children increasing recently. Is this something that we're seeing in the New York area, or that you've seen? Like, what severity of disease have you seen, Dr.
We are not seeing
recently
hospitalizations with COVID in children in the New York City area. Thank goodness. I'm knocking on wood. And the reason is because we have a pretty high vaccination rate, which acts as really a barrier from significant community transmissions. Where they are seeing increased pediatric COVID admissions is in the South, where their vaccination rates are really poor and it's just rampant. There's just so much COVID that kids are getting COVID as well. And, rarely kids get severe disease, very rarely. But when you have so much COVID transmitting, those rare events happen more commonly. In addition, we are having an interseason of RSV. So, RSV is usually in the winter, and because all the respiratory viruses are in a strange environment right now with COVID, we are having RSV in an off season. So I think that's also contributing to the hospitalizations. It's not uncommon that children can get co-infected with respiratory viruses. So I suspect many of the admissions in children less than 2 years old are really RSV co-infected with COVID. But they're getting admitted really from the RSV.
Okay. Is masking, I know we've talked a lot about masking, is that a solution for protecting our kids from all of these respiratory viruses? I mean, I was reading about the flu today. The flu is going to be the next upcoming issue, especially with the kids who can't be vaccinated yet. Is that, is masking a cure-all for that as well, other respiratories?
Masking prevents transmissions of basically all respiratory viruses. So, yeah, that is
Okay.
an option that I think will get used more and more in the future, not unlike a lot of Asian countries did after the first SARS-CoV-1 in 2003.
Right.
Additionally, we're not really expecting a flu season this year. We may, get lucky in that regard to not have a twin-demic, I guess, of COVID and flu. And I say that because, flu starts in the southern hemisphere and then travels north, and Australia really didn't have a flu season. That said, it's even more important that individuals get vaccinated for flu, because if you're not having low levels of flu in the community, your body is missing an opportunity to get their immune boost. So, there's a lot of concern when flu does come back that it could be a severe season because people may have not gotten that boost. But if they get vaccinated, they'll get that immune boost to prevent severe disease when flu does come.
That's great. So, so we have COVID vaccines, we have flu vaccine season starting, which brings me to Dr. Siddiqui, the importance of keeping up with your pediatric well visits and all of your vaccines, right? What are you seeing? Are you seeing people falling behind on that? How do you work to help people catch up?
Yes, you brought up a very important point. So we really want to keep seeing you for your well child care, no matter how old you are. We want to make sure that we see you at least every year above the age of 3, and under the age of 3, we see you approximately every 6 months or even sooner than that. And one of the main reasons is to keep you up to date on your vaccinations, making sure that you're getting the measles vaccine, your meningitis vaccines, your pneumonia vaccines on time, because we don't want to see other epidemics on the rise, right? So we did see a 90%, almost 90% drop in vaccination rates last summer because of the reduction. And we were able to see that because you saw the reduced number of ordering of the vaccines through the Vaccines for Children program. And that's a huge, huge drop. So that tells us that there were a lot of kids that are behind on their vaccinations. So we've been trying really hard to catch everybody up, making sure that they have all their vaccines in place. I think because there was some remote learning going on, people were not, needing to come to school, so they felt like they didn't need some of the updated vaccinations. And it is really important. We're all returning to school now. We want to catch up on all those immunizations. So again, contact your pediatrician. And we want to really push flu vaccine as well, because it is really important to get that flu vaccine. It's approved for ages 6 months and up, because unlike COVID, we do see very serious flu symptoms and severity of the flu in the under 5 age group. So it is really important to get vaccinated in that age group.
Okay. Great. We have some questions coming in about vaccines. Dr. Leiter, can you give the COVID-19 vaccine at the same time as the flu shot, or other recommended vaccines that children just need to keep up?
Yes, you can give the flu and COVID vaccine during the same visit. There's no minimum interval between COVID vaccine and other vaccinations.
Interesting. What about like meningococcal and things like that I know teenagers need?
Yes.
Oh, really? So same thing. Oh, that's great to know. Okay, so it doesn't have to be spaced out or multiple doctor visits. You can get that all done. Okay, wonderful. Okay, I have another question who came in here about very small children. This one is from a new mom who recently went back to work, and her baby is in daycare, crawling around, putting his hands in his mouth, obviously not masked. How, in that situation, what can a parent do to keep their child COVID-free? Who wants that one?
I can take it.
Dr. Siddiqui, I'll give you that one.
Yeah, I get that question. So for the new moms or even pregnant women, it is recommended for them to get the vaccine as well. And it has been shown that newborn babies from moms that have been vaccinated do develop the antibodies. And breastfeeding mothers as well can give babies antibodies through their breast milk as well. So, but for all moms that have small children in the house, and especially babies that are crawling around, it's important to usually do your normal mitigation strategies. So you want to make sure everybody else in the house is vaccinated. If you have them in a daycare, you want to make sure that the adults in the daycare have been vaccinated, possibly for COVID vaccine as well. And you want to make sure that the adults in that center are also wearing their mask, washing their hands a lot, and obviously making sure that if children are not feeling well, they're sent home to get tested, and they see their pediatrician to make sure that there's not they don't have, there's nobody that's has COVID. And so those mitigation strategies do help. Some all babies are going to put hands in their mouth, so that's like part of the normal development. They need that kind of sensory information, so that's normal for them to do that, but you want to provide a safe environment for them.
Right. That's a really good point. Just making sure everything around them is as safe as possible, because babies are babies. That's it. That's right. Dr. Leiter, we got a question here about when is the ideal time to get the flu shot? Is it too early now, or should we be doing that for our children?
Yeah, I think there's no real ideal month, again, because I just think it's important to get the flu shot this season, because I don't think we will have, I don't think we'll really have flu this year, but it's important to get the vaccine to keep the immune system boosted. So whether someone gets the flu shot in October or January, I don't think will make that much difference. It's just really important to get the shot.
Get the shot, get it done with. Sounds good. Okay, we got one question here. It's a little specific, but I'll ask it of you, Dr. Leiter. It says, this person's 12-year-old, received a dose of vaccine and then tested positive for COVID a week later. How long should they wait before they get the second vaccine?
The suggestion is to wait about a month after the acute COVID illness, because you want the immune cells to kind of hone in back to the lymph nodes in a way. So I think the suggestion is to wait about a month.
Okay, that sounds good. All right, we have a few minutes left here. I want to get to the school environment itself. We have some questions here about things like, well, they have to wear masks all day, but what about lunchtime? Dr. Siddiqui, what, is it taking off that mask to eat? Is that putting them at just as much risk? Should they just eat quickly? Is it take a bite and then put the mask back on? What's the protocol here?
So during eating, the suggestion is to have a little bit more spacing. So in the classroom, the suggestion is 3 feet, but during in the cafeteria, we want to increase to 6 feet of separation. Again, the ventilation is really important to increase the airflow. And no, we want kids to eat, so we don't want them to eat quickly, but we do want them to be comfortable while they're eating and to be as safe as possible. So I think, a lot of schools are doing where they have half the students in the cafeteria eating at that distance time, and then half the students maybe outside, and then they switch off to reduce the crowding in the cafeteria area. Possibly having food outside during the warmer months may be a possibility as well. And again, just to kind of wear your mask all the other places. So when you're walking in the halls, going back into the classrooms and things like that, that's where you want to make sure that you have your masks on properly.
Okay, thank you. And Dr. Leiter, what is the role of a proper air ventilation in schools? What should parents be looking for in their child's classroom? Should it be these big air filters? Is it just opening a window? Is it a little bit of both? What role does that play in safety?
It plays a significant role. So I think what's most important are the air turnovers in a space. So, opening a window and making sure it has, good airflow is really important. A lot of the New York City school buildings were modeled after the flu pandemic of 1918, and they have a lot of that steam, that hot steam. because they wanted to prevent another pandemic, the engineers. So that hot steam is there in most of the buildings in New York City, so that windows can get open and that it still remains warm in the classroom in the winter. But that said, New York City invested a lot of money in re-engineering their ventilation system, and it's actually available online, and you can see per classroom which classrooms had an upgrade, and often HEPA filters are in place, or fans were put in place to increase the amount of air turnover in a space. So that really is available online on the New York City website.
Okay. All right, we're just about out of time here. I'll just ask, I'll give you both a bonus round here. Is there anything you really want parents to know that we haven't touched on here? Kids to know, what should the kids know? Let me make that the question. Dr. Siddiqui, what do you want kids to know about safety and going back to school?
I think it's really important that we're going back to school. We're wanting everybody to be in school. I think it will be a little bit of a different year than last year. I think we know much more about the virus now. We have more options regarding it. We have vaccines. So I think it is going to be a much safer environment, and we need to kind of get back into normal times more. So it's going to be a slow adjustment, but I really think that coming back to school is going to be a strong step forward and a strong step towards more normal times.
Awesome. Dr. Leiter, I'll let you have the end note here. What do you want kids to know about being safe in school?
Yeah, I think kids reflect their parents and just the adults around them, their anxieties about it. And if the grown-up around them is excited and reassuring, then kids will feel better about going back to school if they weren't in person last year. And it's also really important that, and I think schools are trying to do this, is to address the emotional and personal difficulties that kids may have had the year prior. A lot of people know someone that was really harmed by COVID or even passed away from COVID. I do think schools need to provide that emotional resource as well in a lot of ways.
Absolutely. And just a little bit of grabbing towards something that feels like normal, I think will help us all to move forward. So thank you both so much. This has been so insightful. I feel much more confident about Monday when I'm sending both of my kids back to school, and they will be very well masked at the same time. So thank you both. Thank you everyone who has joined us here and is watching. If you are looking for if you're a NYU Langone patient or your child is and you need a vaccine, please visit nyulangone.org and you can schedule your shot. If you're looking for an NYU Langone pediatrician, you can search that on our site as well and benefit from that. So again, thank you all very much, and we're done.
Thank you.
Thank you.